Then also don't shave your nipples. Some people shave and go around it. When they see some small hair around the areola area, they want to shave it. You see, when you shave it, you bring small cracks and at times infection can set in.
As you're aware, we are in our breast cancer month. That is the month of October. And today I am having with me in the studio Dr. James Clayman. He's from St. John's Hospital and Fertility Center. Today we're talking about everything you know or you have to know about the breast literature. So today I'm very excited he's with me in the studio. We're talking about the human breast. Please, you're welcome.
Thank you.
But they're looking amazing.
I'm sweet always.
Oh, we thank God. That is always refusing to go. But he told me that Opeso Guta Puma, Obedi 30 na Guta Puma, or nobody 90 no Guta Puma. Choice. Yeah, Daddy. Today we are going to talk about everything about breast. And we are in our breast cancer month. And people want to know one or two questions concerning their breast, and so that they'll know whether if something happens to them, whether it's normal or they have to visit a doctor. So, Daddy, please, what determines a healthy breast?
Thank you. A healthy breast. All right. There are some few factors which should be in place for a healthy breast.
Okay.
The first is that there should be consistent lumpiness. And when I say lumpiness, someone will ask, hey, having a lump in your breast. The breast, when you hold it, is not smooth. It's not it has some lumpiness under it. And
Okay.
what I'm saying, consistent lumpiness. And anyone who examines her breast will know that that bubbling thing under is there. But it should be consistent so that in case some extra lump appears somewhere, then you know that there's an abnormality. So there should be that consistent lumpiness. It's not, when you hold the breast, it's not smooth like a rubber, inside it.
Okay.
That lumpiness is there. All right. Then also the skin of the breast, a healthy breast should be smooth.
Okay.
The skin should be smooth. The skin that covers the breast should be smooth.
Okay.
All right. And then it should have an even temperature. The temperature around the breast should be like your body temperature. Okay. So when you are touching the breast and some place is hotter than the other, then there's abnormality. So there should be an even temperature. Then there shouldn't be any discharge. Apart from someone who is breastfeeding.
Okay.
All right. Someone who is breastfeeding, or someone who is pregnant. When you press the breast, there shouldn't be anything coming out of it.
Oh, okay.
There shouldn't be any discharge apart from during that period. That is it. Then, if you look, I've talked about the temperature, the skin covering being smooth. There shouldn't be any discharge. Then there shouldn't be pain.
Okay.
In it. There shouldn't be pain. But you see, everything there's an exception.
Mm-hmm.
Some people during the premenstrual period,
Mm-hmm.
But it is not a persistent pain. It is something that comes cyclical. You get me?
Okay.
So you know the difference when it is an abnormality, but there shouldn't be pain in the breast, apart from those exceptions.
Oh, okay. Wow. So when you have wrinkles, I say all of a sudden when you from chum.
And then you find out what is causing it.
Okay.
What is causing it.
Okay, so what do we have type of breast?
Like
in terms of the shape.
All right, for breasts, the shapes, we have various types of shapes, and usually they say around 12 types of shapes. Usually we have the archetype breast. The archetype breast is the common breast. So you see that most of the manufacturers of bra, they manufacture it in the type of the archetype breast.
Okay.
All right.
Okay.
And that type is the common one that you get a symmetrical breast.
Oh, okay.
You see, at times some people wonder why my breast one is bigger than the other. If normal the asymmetrical breast, the other breast might be like up to the cup size larger, but it's normal.
Oh, okay, because there was an allegation that if you have one breast longer than the other, it's abnormal.
Thing is that you know your breast.
Okay.
When the asymmetrical breast, when you start your life, when you get your breast, is there. So when there is a change that it becomes longer than usual, that's why I say that the size that is larger or is about a cup size, up to a cup size. But if it's going beyond that, and what I'm talking about also is consistency. It's not something that has now appeared,
Okay, okay, okay.
but it's
So,
something that after puberty you see that the breast is one is slightly larger than the other. It's not that
okay.
out of the blues and the breast is growing big, then that makes the difference. But there's the asymmetrical breast that also exists. Then we have the bell-shaped breast. The bell shape, the base is smaller, and when it's getting to the where the nipple is, it becomes bigger. All right.
Okay.
Then we have the athletic breast. The athletic breast usually there is more muscles than the breast tissue. And usually the breasts are smaller than the breast tissue. Then we have the closed set breast. Closed set breast, usually the breasts are near the center. So you see that the lateral side of the breast to the armpit, there is more distance.
Okay.
Then we have the open set breast, where also the space between the breast is larger and the breast is nearer to the armpit than usual.
Oh, okay.
All right. Then we have the east-west breast. The east-west breast is where the nipples, one is facing west and one is facing east. They are that kind of. Then we have what we call the slender breast. Usually they are smaller throughout. That is the usually is longer. Then we have the teardrop breast. The base is smaller, but when you come into the end, then it's bigger with the nipples. There. So these are some of the types of breast.
Okay, so with the type of breast that you just mentioned, can somebody be born with say yeah one dada?
The thing is that it doesn't happen that way. That you
Okay.
are born and the breast is already
Sagging.
sagging. It doesn't happen that way. Usually, I mean, it stands, and due to how you treat it, then it sags.
That brings me to my next question. What are some of the things that we shouldn't do to our breasts as women?
All right. First, it's not advisable sleeping on your breast. Where people sleep on their stomach. It's not advisable at all sleeping on your breast. Then because when you sleep on your breast, it virtually sucks it, it presses it, and it deshapes it.
Wow.
Then also you shouldn't wear old bra. Bra expires. When you can't wear one bra 5 years you are wearing, because the thing is that the old bra, the elasticity goes off. It's no more elastic and it sags. So it makes the breast sags. And when the breast sags, it pulls you. So at times you have pain in the spine or pain in the neck. So old bra, you shouldn't wear old bra. Then also don't shave your nipples. Some people shave and go around it. When they see some small hair around the areola area, they want to shave it. You see, when you shave it, you bring small cracks and at times infection can set in.
People shave their bra.
Yeah. And I mean that. Then also, don't wear ill-fitted bra. You see, the issue fit. At times people just buy bra anywhere, anyhow, and they put it on. It's at times advisable that you go to a special place where they sell bra, where there are professionals who can tell you your size of breast and the bra that is fitted for you. That is fitted for you. Then also something like smoking is not good for your breast, because the breast the nicotine destroy the elasticity in the breast and it sucks it faster.
Wow.
It makes the breast, it sucks the breast faster. Then also it's not advisable tattooing the breast, making tattoos on the breast, because you see the tattoo ink itself at times can be carcinogenic, developing of cancer.
Wow.
So it is not advisable. At times it can introduce infection, and depending upon the tattoo parlor, whether they really sterilize their instrument, at times you can be infected with hepatitis B and hepatitis C from some of these parlor. So it's not advisable. Then also, it's not advisable. What do they call it? Now they put ring anywhere and
Is it
everywhere.
piercing?
Piercing, piercing the nipple, piercing the nipple, that also is not advisable. It can bring about infection. It can bring about infection from, even as I was saying, you don't know the piercing plays a part, whether sterilization is good enough. You can get hepatitis B or hepatitis C from there and other infections. So it's not advisable piercing the breast.
Hmm.
Then you shouldn't ignore any strange new thing you feel in your breast. Don't ignore it.
Okay.
Like you get a lump
Mm.
and then you are ignoring it. No, it's something new that has come. You have to see your doctor or you see your nurse or specialist so that they see what has come. Don't ignore it. There are some things you can just, ignore it. But when it comes to that, when you are having pains, don't ignore it in your breast. Don't ignore it. Then at times, some women, when they are pregnant, at times some of them naturally their nipple is inside. And at times when they are pregnant, they want to pull it out so that when they give birth, that pulling it out at times can cause infection, at times can cause unnecessary pain. Find a way out, use breast pump later or whatever, because pulling it out or so. So these are some of the things you shouldn't do for your breast.
Interesting. You were talking about lumps. That when you maybe rub your finger around your breast, you should feel it shouldn't be smooth. It should be kind of looking at how God created it. But most of the time, how will you be able to determine that there is a foreign lump in my breast?
Every woman is advisable that from age 20, you should cyclically examine your breast. Cyclically, which means, and it's better if you do it a week to the 10 days after your menses. Let's say you start your menses first day one.
Mm-hmm.
On the 8th day and the 10th day, is better that's the right time. That time the breast becomes lighter. Okay. And if there's something, you can feel it. If your menses is irregular, then choose a particular date of every month that you examine your breast. All right. So from age 20, you examine your breast, and examine your breast first. You look at your breast. You stand in front of a mirror.
Okay.
And you look at your breast. All right. You look at your breast with your hands on your hips.
Okay.
All right. You look at your breast with your hands raised behind your head, and then you just look at it with your hands beside it. All right. It stretches the breast in various ways so that if there is something strange, you will pick it and see it. So you examine it first visually.
Okay.
Then you palpate it. And the palpation at times is advisable when you are bathing, when there is soap on it or water on it, it becomes smoother, it slips over it. And the examination of the breast, you can start from the base cyclically to the nipple.
Okay.
Or you can do it radially. That is, you start from the nipple and you go to the base. You go to the base. You go to the base, all around it. You get me? And if you start doing that, then if there is any change, then you pick it. If you regularly do it, you pick it. Unfortunately, at times some people come to the clinic, they don't even know their breast. Now, if you ask them, is there fluid coming out of your breast? They don't know. They don't know. And then you tell them, all right, press it here and let's see. You should be able to know whether there is something coming. You should know your breast. If you don't look at your breast, where are you looking? you should look at your breast. Yeah. So that.
Okay, so growing up, I see some parents trying to, I don't know whether they were trying to massage the breast of their wart or they are trying to making sure that it doesn't become big. But almost say mana bobo no for no pen no more the tapolio say tano mo de bobo.
No, actually, what I know is that at times when a child is born, because of the hormones, the estrogen at times in the mother, what some remain in them. When the child is born, at times something like the breast is like forming big abnormally, a child, baby, and the breast is like, then they feel that fullness in it. Traditionally, I understand they use the tar that they use to mine the contumely in the apotoyuan.
Tapoli.
They use it to hit it. The thing is physiological. It will go by itself.
Mm.
Most time when they hit it, they crash it. And at times it becomes infected and forms an abscess. It becomes infected. And at times they touch it so much, this one will come and touch it, this one will come and touch it. And all the fingers, they are not sterile. So you see that the breast gets infected. And when the breast gets infected and heals, at times it can destroy the ducts, so that later on when the person is secreting breast milk, it might not be able to come out and it brings other problems. So if you see that lump or that thing in the breast of the baby or the toddler, leave it. It will go by itself. It's physiological.
Oh, okay, but I have seen a situation where 12-year-olds and 14-year-olds, their parents were trying to use tapoli to, I don't know.
What are they doing? Leave it. It's physiological. That tapoli, you are mashing it, you are crushing the tissues, and at times it can form scars. You traumatize the tissues, and later on it will form scars that you don't see in it, and those scars can cause chronic pain in the breast.
Asemu, sometimes when parents give birth, I learned there is a particular period that the breast milk is healthier for the ward or the child. Which period is that? And what is the color of the breast milk?
The thing is that every breast milk that comes after delivery is important.
Okay.
Every breast milk. Normally, when a child is born, the first 3-4 days, the breast milk that comes is something creamy kind of, and at times they think it's dirty, so it shouldn't be given to it will be set away. But that milk, it is a physiological. God in his own wisdom is using that to treat that child, prevent that child from getting sick. What happened is that milk, that first 3 days, 4 days milk that can, we call it colostrum. The colostrum contains immunoglobulins that help in treating the intestinal tract, the bacteria that are harmful, they get rid of it, and also they contain something like antibiotic, which helps in the child having the first toilet and cleaning the guts and other things. So it is very good.
Okay.
It is very good. That first thing, it's for a purpose. Then after that one, then the transitional milk comes. The transitional milk is between the colostrum and the main one that will come. That also is for a purpose. Before the main milk comes, and even the main milk, we call it when you are breastfeeding, we have the fore milk and the hind milk.
Okay.
All right. The fore milk usually contains sugar and more water. So it's like you are satisfying, the child is thirsty, so he's getting the water. That is why when you are doing exclusive breastfeeding, you don't give water, because there is water enough. That is the fore milk. The hind milk contains the fat, which makes the baby satisfied. Okay. So if you are breastfeeding a child, that is why when you are breastfeeding a child, you should breastfeed so that breast becomes empty. Because if you don't take time and you breastfeed here, it is not empty, and you put it to another breast, it means that the baby has only received some sugar and water. It didn't get the fat, which will make the baby satisfied, and the baby will start crying in some few time because it's not satisfied. But when the baby sucks the fore milk and the hind milk, which contains the balanced food for it, then after it sleeps.
So how many minutes or hours should it take for the baby to take?
The breasts are different, so I won't give you minutes and hours and other things. When they are sucking the breast and it's empty, the mother will know that the breast is light.
Okay. So they should suck one particular one.
Finish it before they go to the next one.
What if they are twins?
And then they should be, one is one breast, finish one breast, one is here finishing one breast. What I'm saying is that the baby should be made to suck the fore and the hind milk. It shouldn't be just the one part. That is it. If you make a mistake and let's say you let one, let's say twins, you let one suck a little and it didn't suck the hind milk, and then you put the other baby to suck that one. That one is sucking the hind milk, getting the fat, and it will get satisfied, and the other one will be crying because it just got some water and some carbs.
So please, is breast implant important? Because there are so many people who think maybe they have small breasts or smaller breasts and they want to make it enlarge it, and there are other people to maybe they've gone through a cesarean section where you try monofo. Those people they want to do some silicone implantation and stuff. Is it really good for us?
All right, the thing is that what I would say is that if the person hasn't got, if they've done mastectomy, all right, they've removed the breast completely and you want to put something there, fair enough. But let's say if you have a breast, you say the breast is small, you put implants there. Implants have their side effects. Implant, first thing, the operation, the anesthetic, there can even be, before the operation start, there can be the ones who give medicine so that the person sleeps or the person doesn't feel pain. There can be even a complication from anesthetics.
Wow.
There can be a complication for the anesthetic. So that aside. Then also, it is known that the implant can cause what they call the anaplastic lymphoma. That's a cancerous state. So it can cause that. Then the implant also can cause, putting the implants there can cause bleeding there, what we call hematoma. There can be bleeding in the breast.
Internal bleeding.
In the breast.
Wow.
Bleeding in the breast. That can form hematoma. It can cause infections. It can cause infection. Then where the implant is around, it can form a capsular scar. It will form some scar around that implant, and that will harden, and that causes pain. That can cause pain. Then the implant itself can leak. It can burst and leak.
Oh, so when it leaks, where does it go? Does it come out?
It's going into your tissues with all the other complications that can come. So the implant is not as safe as it seems or is advertised. It has its effects.
Sir, please, do we do sometimes they say the perfumes and the deodorants that we use, sometimes maybe you spray your armpit and it can cause breast cancer.
All right, what happens is that normally most of the deodorants contain what we call aluminium, and that aluminium forms a plug in the sweating gland and prevents the sweat. There was that idea that if that sweat doesn't come out, it contains chemicals that can go in and cause a breast cancer. Some of them also were thinking that the preservatives in the deodorants and the antiperspirants, that those preservatives can. But research have been made into detail, and they have not come out to say that any deodorant or any antiperspirant causes breast cancer. There is not yet a research that I've seen.
Wow.
That has come out with that.
Interesting. So please, can breast cancer be hereditary?
Oh yeah, breast cancer can be hereditary. It is known that about 5 to 10%, and even some stretch it to about 27%, but in most of the literature, about 5 to 10% of breast cancer is hereditary. There is some gene we call it BRCA1 and BRCA2. These are genes in the genetic code of a human being, and that genes normally, when they are normal, that genes form a protein that repairs the DNA. When we have something in the cells we call DNA, they repair it, and those contain also genes that control the system. If there is a problem, they repair it. But at times, these two genes, BRCA1 and 2, there can be mutation. Mutation means that a change in it, an abnormal change in it. And when there is that abnormal change, it's transmitted from mother to the children. And that abnormal change can, due to that, because of that, there's uncontrolled production of the cells, and that can form a cancer, and it can be transmitted from parents in the family line. It can be hereditary.
Okay, so Daddy, when you were talking, you made mention of the fact that we have the full milk and the high milk. That is very important for children. The one that looks creamy. So my question is, if a mother has cancer and has given birth, and fortunately the child wasn't really affected of the cancer, how then do the child get the breast milk that he or she needs?
The idea is that At times, some people will have the breast cancer. They don't know even they have it, and they breastfeed. There's nothing wrong with it. But where they say breastfeeding of a woman with breast cancer is not advisable, is that so far as the breast cancer has been seen, it means that it's being treated. All right. The disadvantage or what is not good is that if the woman is being treated, the chemotherapy goes into the milk and it will affect the baby. It's not good for the baby. The hormonal therapy goes into the milk and it's not good for the baby. So the therapy that is given is not good for the baby. So it's not advisable giving to the baby. That's the issue.
Interesting. I think that there's too many things that we have to really consider as women. So, Daddy, please, you spoke about our menstrual cycle. I want to know whether our menstrual cycle can form maybe a deformity in our shape, because some people they give a comment that when they are about having their period, that's saying
All right.
so that one is it normal?
Yeah, it's normal. The thing is that it's all depends upon the hormonal aspect. You know, whether you like it or not, the menstrual cycle, the cycle is a preparation for pregnancy. So there is a preparation for. Generally speaking, when we talk about menses, what is menses? Menses is virtually a disappointment for the womb, because the womb was made. The purpose of the womb is to get pregnant and keep the baby till it is at term and you deliver it. The main purpose of the womb was not for menses per se. So what happens is that during your menstrual cycle, like first the inside of the womb is prepared to receive the baby. What we call the functional endometrium, something grows into the womb, to prepare so that in case the baby comes, it will get some nutrients while it is still small. So the womb is prepared to receive that baby. All right. In case there is no fertilization, then the blood flow to that preparation is cut off, the blood vessels get broken, and that preparation peels off and come out, and that is menses. So menses is not like a woman should just bleed every month. No. What is coming out is the preparation that the baby did not come. It's just like when you are in the village. When someone is coming to visit you, you put the mat on the floor to receive the person. If the person doesn't come, you fold your mat. And that is what happened. If pregnancy doesn't come, the preparation that was made for the baby peels off and come out. And that peels off the functional layer is the menses.
So why do people bleed like?
So the thing is, it is not a bleeding time. That is why the research have shown that for a normal menses, the bleeding or whatever should come out should be about 30 to 80 mils. 30 to 80 mils. You know what is 30 to 80 mils?
Like a 50 pesos coin.
So the thing is, from the first day to the last day, what is expected is about 30 to 80 mils. And 80 mils, one normal cup is 250 mils. Look at the sachet, the water sachet is 250 mils. All right. If you divide it into two, is what? It's 125. If you divide it into two, it will about 60 something. All right. So the thing is that what should come out is a little more than when you divide it into four. So look at the sachet. So the blood that should come out from the beginning to the end.
And should be like the sachet.
The sachet divided into four, approximately. So the thing is that it's not a bleeding time. In Ghana, at times when they are talking about menses, it's like some palm one tapper putting some architecture under some palm one tree and wanting something to flow in. As someone would say that, oh, when I have my menses, it flow well, it is red, and I soak 6 pads and it's happy. The thing is that when the average pad, when it's soaked, it's about 39 mils of blood, 39 mils. So if you soak 6 pads in a day, 2 pads is already enough for. I mean, when you really soak 2 pads, you should have finished your menses. But if you soak 6, you are really bleeding. It's not advisable. And medicine shouldn't be read throughout because the preparation is usually dark. It is usually getting the tail end that you have some bleeding. So when you menstruate and it's dark, it's not a disease. It's not a disease.
Nyankopɔn wabɔ mba na afei yɛ ho nsɛm bebree yɛ ho nsɛm bebree ɛyɛ asɛm and so right now it's our breast cancer month. What will you tell somebody who is healing from breast cancer? What will you tell somebody who has in fact, can men get breast cancer?
Yeah, 1 and 2% of men, breast cancer is from men.
That one.
They have breast too. Yeah, so they can get breast cancer, but only that it's more with women.
Okay.
Because we also know that the mutation of that gene, the genetic heredity, if it is in your line, you the male also, you are in that line, you can also get it.
Oh, okay. So apart from the hereditary aspect, on a normal, men
also can have breast cancer
without passing on to.
Without hereditary, is not common, but they can also get breast cancer.
I see. Interesting.
So if you're a man and you see some lump in your breast, it's not a joke. You should go and let them find out what is there. What is there? What I can say is that the sad thing in our country is that people come with the breast cancer when it is at its late stage. About 60 to 70% of breast cancers that come to the hospital are at the late stage. And the breast, we have the stage 0, which we call the in situ. It is small, it is started, it's still in the duct. Then we have the one that the lump, you can feel the lump. The lump is about less than 5 cm that is there. I think 2 cm. And then we have the 2 to 5 with some, the node. Then we have that one which has also affected the other breast. And we have the 4th stage, which is gone and at times spread into the lungs and other places. But if you come with the in situ one and the stage 1, that can be completely treated, 100%.
And it will go to 0.
Yes, it can be the in situ one, the stage 0 and the stage 1. It can 100% be treated. If you come with stage 2, it's about 99-95% treated. Then it's when you come to stage 4, that's about 25%. At times you have to take it off with all the complications and other things. So the thing is that every woman should regularly examine their breast, so that when there is a change, you go to the hospital and the doctor examines you, that if there is anything abnormal, they pick it up. And breast cancer is not for the church. It's not for the church or the herbal base. It's for the hospital. Don't go and sit. If you believe that God can heal you, I lie this way. God can heal. Yes, I believe in miracles. But you see, your miracle should, even when you are talking about your miracle, you should talk about it sensibly. How will you talk about it sensibly? When you go to the hospital and they diagnose that it is cancer, and you are there and you are treating and they pray for you and it disappears. When you are giving your testimony, then you can give a better testimony that they did all the things, it was really there, and as I was treating, they pray and it disappeared. The thing is that you don't need to sit in the church room. People sit, from what I know, people sit in Ghana, they pray for people in London and they get treatment. So you don't need to sit. If God can work as you are going to the hospital and the doctor is playing his part, they can also pray for the spiritual aspect also to work. After all, when they work hand in hand, then you get the best treatment.
So, go
to the hospital, let them pray. I think even if you go to the prayer camp, you are doing one-sided treatment. Go to the hospital. As they are treating you, let the prayer also go on, so that you are getting physical and spiritual. So the treatment is augmented on the spiritual field and the physical field. Don't go and sit in the church. That place is not the place for you. Most times they sit there, it become worse. When you are dying, then they push you to the hospital.
Daddy, so what will be your final words? Now that we are in our breast cancer month, do you advise that we all go to the hospital for a checkup after a self-examination?
The thing is that what I would say is that the self-examination should be done.
Mm-hmm.
That it should be consistent so that you can pick any change there. And usually the advice is that when you get around 40 years, you have to do the mammogram, to check what it is. And if you are in a family where your mother had breast cancer, most of the hereditary one, they occur before even 40 years. They occur younger, in a younger age. So that one you need to, do the checks and go and do the mammogram, before that time.
Daddy, please, your final words.
My final word, what I would say is that, you see, breast is a very precious organ in the woman's life. And for precious things, we make time for them. My father will say in tree that if you don't get time to examine your breast, by the time you are aware, you have been taken by surprise. But if you are someone from 20 years, you consistently, every cyclically examine your breast. When anything is appearing, you pick it up and go and report it. So I will encourage everyone to examine her breast consistently. You don't wait for the cancer month or cancer week before you start examining your breast. It should be a part of your life. Get time for your breast. The bra and the thing you are wasting, buying expensive bra. The free one where you yourself can examine your breast, you should get time to examine your breast. How many minutes will it take? Every month, examine your breast once by yourself is too much for you. Then you might not value your breast as I value breast.
Hey, breast cancer, they are several. Thank you so much for coming on the show. That I'm very grateful. You've said a lot. And viewers, today this is where we draw the curtains on today's birthday light. Today we spoke about breast. Please, breast is very precious to all of us, both genders. Breast, so please let's take time and then examine our breast at least once every month, and we will be fine. Thank you so much for joining us in today's section. My name is Priscilla Moore. I was here with Dr. James Clayman, who spoke about breast and all that you need to know about it. I hope you enjoyed this particular episode. A big shout out goes to Kweku Ilbang. Kweku Ilbang, thank you so much for making this production a production. Don't forget to log on to our Facebook, CMGA TV, YouTube CMGA TV, Twitter at CMGA TV, and Instagram also on CMGA TV, and our social and our website, www.cmonline.com.gh, your authentic online news portal. On to another episode of this wonderful show. Bye.